No, my boobs are up.
Okay.
But remember, just in case the
Sorry, guys.
the phone, I gave you the little pen so you can. You know how I broke my screen?
Yeah.
Don't worry though, I ordered a new phone.
Did you really?
Yeah.
I know this one's important. Keep it up on your wall.
It is very important. But... Hi, Dr. Filsu.
Hi.
This is Dr. Filsu. He's the cardiologist that's helping us out here.
Yeah.
This was Moniece during her pre-op. We saw some interesting findings on the EKG, and we just wanted to get a little more information. And Dr. Filsu is the big cardiologist here at Cedars, so he's the one that's going to ultimately, I hate these filters you put, ultimately let us know if it's safe to do surgery or not. So, what are we doing today?
So we're gonna first do an EKG, make sure there's no conduction disease, no heart blocks, no electrical issues, and then we're gonna take pictures of your heart to make sure the heart looks good, no dilation or thickening or stiffening, good function, good pumping, and that should be good.
And nothing you're going to do today is going to cause any pain or anything invasive, right?
And zero. We're just taking pictures.
All right, very good.
Okay, so I have a question before we get started because my fans really want to know, and so do I. What could have caused the irregularity in the EKG that Dr. Shaffa shared with you?
So given that I looked through your history, it's pretty benign. Most likely one of the medications is just irritating you.
Okay.
So we may stop it. And
I stopped last week Tuesday when he
Good.
called me.
Okay.
But I didn't stop the Lamictal, but I did stop the Trazodone and the Chantix because I looked at both of those and they're what, beta blockers?
No.
Or not beta
One
blockers?
is a sleep medicine, one is a smoking medicine.
Right, but they both slow down the heart
They
rate.
can.
Okay.
So we'll see. Most of the time it's medication side effects, drug interactions.
Okay.
So we'll repeat it again, make sure it looks good, and then we'll bless you.
Amen. Okay.
Okay,
All right,
we'll
Dr.
step
Shaffa,
out.
put the
All right, guys.
camera on you.
All right.
Who's taking my heart pictures?
She is.
She's in charge of everything.
Oh, I have one more question. She
Yeah.
told me to ask you. Okay, so I had my breasts done in 2017 and then 2 revisions in 2018.
Okay.
Normally, like, my nipples are kind of like cold.
We're not going there.
I know, but I have just a quick question.
Yeah.
Maybe you have the answer, or maybe you have the answer. Normally, my nipples are really cold, and I got scared because I was like, oh my god, my EKG was irregular. What if something crazy happened to my implants, right? So all week, my breasts have been on fire.
Mm-hmm.
Why get
Unrelated. Completely 100% unrelated.
Okay, good. Okay, that's all I cared about.
No,
As
you're
long as
good.
you don't have shingles or acid reflux.
No, not that I know.
Yeah.
Okay, okay,
Completely unrelated.
okay.
Should
All
be
right.
nice and boring. Okay.
Guys, so
Amen.
somebody asked, did she get tachycardia or bradycardia? Would you
bradycardia.
mind? Yeah, it was actually bradycardia with, what was the actual term that they used?
AV disassociation.
Right. So
What does that mean?
the medication may have caused the electrical conduction of your heart to change a little bit, slow down the heart transiently.
If you want, we can take the pictures.
But given you have no
I see.
symptoms and no history, it should be just fine. A lot of things can cause that: infections, medications, stress response, sleep disorder, a lot of things. But in a normal, healthy patient, it's well tolerated.
So what's a good heart rate between what and what?
Depends on your age, depends on your
I'm
level of
36.
physical fitness.
I don't move.
Yeah, don't know. Depends on, there's no other disease, you don't have thyroid disease, you
No.
don't have anemia.
No.
So a good heart rate should be between 60 to 80.
Well, mine was 70.
So that's good.
But it was abnormal 70.
But we'll see. We're going to do another one and compare.
They're going to do it today, and we'll look at it, and we'll see how it looks.
Okay.
All right, just breathe.
Will the
You'll be
heart
fine.
rate go back to normal? If that... They said we are both very handsome. All right, we're going to step out and let her
They need
do
new
this.
glasses.
I've got your phone for 5 minutes. I'm going to bring it right back.
Okay.
All right.
If anything pops up, Dr. Shaffa, just use the pen.
I got you. I got you. All right.
Let's get a few words from Dr. Sim.
Let's come in this office, guys. If you have any questions while they're running that test in here, 60 to 100 is normal. Dave, is 60 to 100 normal, or is 60 to 80 normal?
Between 60 to 80 is normal.
Is ideal. 80 to 100 you don't necessarily treat.
No,
but
we don't necessarily, but we'll investigate it and see why.
yeah. And guys, there are times my heart rate, sitting here right now, my heart rate was 107. Yes, we're both married. Thank you very much. My heart rate was 107 just sitting here.
And you just had 2 cups
so
of coffee. So
I had my Starbucks as I walked in, and he said he wants to start me on medicine, but we're going to hold off on that. Will smoking cause this?
Not independently, but smoking has its own issues, but it wouldn't cause this problem. But.
Yeah, and I do want to say actually that in anticipation of surgery, Moniece actually had quit smoking, and to assist her with smoking cessation, she actually used Chantix for a short period of time, and Chantix could potentially cause these arrhythmias or dysrhythmias. So she has stopped the Chantix, and hopefully that
should resolve everything.
Hopefully she's back to normal today. That's what we're hoping to see. But otherwise, she's in good hands here. So is she having surgery? Sorry, I can't read the whole question. Yeah, we are absolutely planning on having surgery. However, like I told her at the very beginning,
always safety first.
That's it. We will do the surgery the second she's safe to do the surgery. Nothing matters as much as safety. And my old mentor used to say, it doesn't matter how pretty you are if you are dead, and that's 100% true. Dr. Filsuf, can weed cause heart problems?
Well, everything can have an effect. In and of itself, it's pretty safe, but anything in excess with combination of other disease processes or medications can cause problems. But in a healthy patient, in small doses, it's completely fine. But you have to take it into account of the person.
Yeah, everybody is different. Can inappropriate sinus tachycardia be reversed?
We have treatment for it, absolutely. I don't know about reversing it or curing it. It's something you live with, that we treat, and we keep it under control. If we wanted to cure it, typically we would have to put a pacemaker in. I don't recommend that. We have some pretty good medications to suppress it.
Yeah. You are probably... Oh man, I can't read that whole thing. Her phone screen is cracked. I apologize. What is the update? The update is she is in the room getting her echo and her EKG done in the exam room next door, but they had to undress her for the exam, so we stepped out, and I will give the phone back to her in just a moment when they're ready for us. I wish Moniece... Yeah, you'll take it with you. We are at Cedar Sinai today, guys. This is East Tower we're in. If you guys know Cedars, but this is right next to my office. When getting hip dips fixed, is the fat from lipo being injected into the hips? That's a great question. Yes, it is. When you do a fat transfer for the hip dips, you take the fat from the liposuction, you clean it, you wash it, you purify it, you process it, and then you transfer it into the hip dips. You can also do it with Sculptra, though in her case, since we are doing the liposuction anyways, to help smooth out that back a little bit and help with some other issues, we will have the fat to do, so there's no need to go with Sculptra. I like hip dip fat transfer actually a lot more than I like butt fat transfer, to be honest with you. And Moniece is not doing her butt at all. We're just doing her hip dips, but it's a much safer procedure, and I think it gives great results. Are you able to scroll up and see my comment, Lady D? Give me a minute. Let me see. This is Moniece's phone, so I am not... Lady D, are you able to scroll up and see my comment? I'm sorry, Lady D, I lost it. If you want to comment again, you're welcome to. Is it better to do awake instead of being under anesthesia? For every patient, it's different. Obviously, I think I do more awake lipos than anyone else in Los Angeles, and it's kind of a bedrock of my practice. However, I don't think it's any better. I don't think it's any worse. I think there are limitations to awake that you don't have in general anesthesia. So in a lot of ways, I prefer general. However, any opportunity to avoid anesthesia, if it's unnecessary, I am fully in favor of, and it saves you money. I got cleared with a sinus arrhythmia. If your doctor cleared you, your doctor cleared you.
Sinus arrhythmia is normal.
Sinus arrhythmia can be normal.
It is normal.
It is normal, he says.
Yeah.
Does she need a chest tube? Absolutely not. That's crazy. Doctor, why do holistic doctors get unalived? I do not understand what that means. I apologize. Will she get clearance from surgery today from the cardiologist? Yes. Nobody can predict the future. If she is healthy and a good candidate for surgery, he will clear her and let us know. And if she is not, he will also let us know and figure out how to treat her. That's why we're here. I'm wearing a heart monitor for palpitations even though my EKG was normal. Is it possible the nerve in the breast could be getting its sensation back? It is possible, although it's been about 5 years since her last surgery, so that to me, the timeline doesn't fully fit, but she may be having some anxiety, and she's obviously been changing her medications around a little bit, so there's something that could be happening here. Nothing scary. So you do surgery on patient. Sorry, her phone is cracked, guys. I can't read every comment, but if you give me a second. So you do surgery on patients with hypertension on 4 meds.
It's controlled.
If it's well controlled, even on 4 meds, it's well controlled. As long as the patient is safe for surgery, then surgery is a safe option.
Also lowers your blood pressure.
That is true. Anesthesia also does lower your blood pressure, as do some of the pain medicines that we give.
We're doing a live Q&A with the plastic surgeon for pre-op.
Please take good care of her, Linda. That is absolutely our plan. Hopefully testing goes well and she's cleared. Knock on wood, guys. My fingers are crossed for her. What is she getting done? We've got a long list of small things that we're planning on doing, honestly. We had talked originally about a tummy tuck and some other procedures for her, but today she didn't really want to do the big stuff. I know she's got a lot going on in her life that she wants to focus on, so we're really trying to keep it small with an easier, more manageable recovery for her. So we're doing a little bit of liposuction. We want to clear out some of the rolls on her back, just help her feel better about herself. We're going to do Renuvion to really tighten her skin. That's the majority of our procedure, is really using Renuvion and trying to tighten that skin down as much as we can. She doesn't have a lot of fat, honestly. Then we're going to do the Avily to her butt to clear away all of the butt dimples, the cellulite dimples, those awful cellulite dimples that everybody hates. Avily is finally a product that actually works to get rid of them. So we're going to do a few small, kind of minimally invasive things on her. After that, we've got her ready to go with the Evolve for some muscle toning and some other things. And honestly, the way I described it to her was, if she is happy with herself at the end of that, happy with her body, she has her confidence back and she's feeling good, then that's all she needs to get done. If she still is feeling kind of bad about herself, doesn't like the way she looks, doesn't like the way she's fitting in her clothes, and she wants to do something more aggressive, we have other options, the things like tummy tucks that we had talked about.
I got your eval request. I'll do tomorrow. Not much. You didn't do your notes here. I'll save you. I don't need to talk.
Does liposuction hurt? What is the recovery time? Yeah, it's uncomfortable. It is. It doesn't hurt necessarily, but it's certainly not comfortable. It'll take a few months to fully recover, but usually within about a week, patients are feeling pretty good and back to normal. To be honest, Moniece looks great. She just needs the hip dips filled and a skinny BBL. I agree with you, and she doesn't even want the BBL. So we're going to do the hip dips. We're going to do some skin tightening. We're not doing anything major this time. Hip dips, skin tightening, Avily for the dimples in the butt, and if she is still not loving the way she's looking or the way she's feeling, then we can discuss the bigger surgeries. Do you have patients? So psych? Yeah, of course. Actually, I had a patient that I canceled because they did not get cleared by psych on the 20th. So if anybody wants to come in on the 20th, I officially have nothing to do that day because I had a big case and her psychologist asked me to hold off. If they're a private practice, trust and believe they care about filling their pockets. That's very sweet. Actually, Dr. Phil Souf is doing this at cost. What is Renuvion? Renuvion is the ultimate skin tightening laser. It's also known as J-Plasma. That was the old name for it. But Renuvion is a helium-based radiofrequency device that heats up the skin, the undersurface of the skin, to about 81 degrees centigrade. So much stronger, more powerful than any other skin tightening device on the market. So it is, I say, the strongest skin tightening device that exists, the best tool we have, short of a tummy tuck or short of surgery. Does anesthesia affect serotonin in the body? I'm not aware. Not that I know of. What can we use for cellulite? Avili. I'll say it a million times. Avili is the only tool that actually works and is actually safe. Avili is a game changer in plastic surgery. Call the office. We'll get you on the schedule. I would like more info, please, as to the services you order. J to the Sanchez, that's a cool name. Message me on Instagram. How many surgeries do you perform a day? Usually 1 or 2 maximum. I like to take my time. You guys do the surgery in the hospital? Not typically, no. I do have one scheduled here at Cedars this month. Usually my hospital surgeries are limited to cancer reconstruction surgeries. I do a lot of breast reconstructions here at the hospital. I have a patient who I'm doing here in the hospital this month who has a history of liver transplant in the past, and just out of precaution and safety, I wanted her to be here in the hospital. So the day you're free, we can get consultation and surgery in the same day? Typically, no. As you guys saw with Moniece, any patient who is having surgery absolutely needs to get a pre-op workup done. And 99% of the time, everything is perfect and fine, and we proceed with surgery as scheduled. But that 1% of the time where we find something that we need to investigate, we investigate. So no, I don't like to do surgery and consults at the same time. I like to make sure my patients are all safe. I'm not taking a chance with anyone's life. Why is that same doctors aren't keep on anesthesia use? I'm sorry, I don't know what that means. Avili is permanent. Avili is permanent. Absolutely. So you're a plastic surgeon too and a cardiologist. That's a great question. No, I am absolutely not. I am a plastic surgeon and only a plastic surgeon. I am here.
1 cardiologist, 2 cardiologists, 3 cardiologists.
Surrounding myself with cardiologists at Cedars. One of the nice things about being at Cedars is that you are surrounded by the best. So I walked across the street from my office and I joined my friends in the cardiology suite, and I'm allowing them to take over this workup. Do you require your clients to have a recovery nurse for the first 24 hours? Absolutely not. Depends on the procedure. If it's beneficial to them or not, it is not required. You're a life surgeon. Thank you, Mag. When does the full stage come in for BBL? When does the fluff stage come in for BBL? I don't know if I know what that means. I apologize. Are pacemakers good?
Pacemakers can be life-saving. Obviously, nobody comes in wanting a pacemaker, but definitely prevents your heart from beating too slow or you passing out.
If you need a pacemaker is good. Oh, do you have one here?
We can show them pacemakers too.
Here are pacemakers, guys.
Is this small?
And you implant that in the body?
Show them where it goes.
Implants it. Yeah, I'll show on Dr. Galucci. It goes over the chest. We implant it under the skin.
Right
So
under the skin, and it plugs into the heart, right?
Plugs into the heart, and it saves lives.
Very cool. Dr. Filsuf, let's go back and see. Guys, let's go in and check on her. Oh, never mind. Sorry. You all good?
Yeah.
I'm going to pass the phone back to you. I think I did a serviceable job. I know I'm not as interesting as she is, guys, but thank you for the great questions. I'm going to pass the phone back to Moniece in just a moment.
You're gonna get my results, right? You can't.
He's
going to
get your results.
No,
I got to get to
tell
my
your
wife.
but just 5 minutes.
5 minutes. Okay.
Okay,
5 minutes.
I'm so nervous.
Okay, so let me take a look at EKG.
Okay.
Other than you being a little nervous, it's fine. See, her heart rate is 107, so it's a little fast,
Okay.
but it's normal now. It's not. There's no dissociation. So that tells us your conduction system is healthy and at a high heart rate. Everything's nice and in rhythm. So good.
Okay.
Okay, so can we assume that it was the medication?
Yeah.
Can we assume it was the Chantix?
That's why
Or
you
the
gotta-
trazodone.
Or the
Well, that's
trazodone?
why whenever you start a medication, you've got to make sure the dose is correct and there's no side effects, there's no drug interactions,
Show the echo.
and then you can continue it. Okay, so your heart function looks good, nice and coordinated contractions, very strong contractions. Nothing's dilated, nothing's stiff, nothing's thick. None of the valves leak. So it's a very healthy, youthful, strong heart. We say no one has broken this heart.
Well,
Well, you know.
I would beg to
I can't
differ.
account for,
Let's just say I'm
the significant others. But
Yeah, I'm
yeah,
resilient.
she's resilient. Obviously, you've taken it with grace and pride, and you bounce back. You're ready for the next day. But in just looking at this echo and EKG and your history, you're definitely clear and a good candidate and safe. We'll put our stamp of approval. You can have the surgery whenever you want, and you're very healthy. So congrats. You do
I'm
not
gonna
need a
cry.
cardiologist. You do not need me. You do not need a cardiologist. You're boring. So just be careful with the medications you take, and just make sure you get checked out every time you take a new medicine. But you are fine.
I'm so
Congratulations.
emotional.
Congratulations, Moniece. Dr. Filsuf, thank you very much. Guys, I gotta get back to my own office. Take a
Mazel
breath.
tov is how we say it in
I
our
will
culture.
call you from
Mazel
the
tov.
office tomorrow. We'll figure out scheduling, okay?
Okay.
Bye, guys.
I think
I'm just so emotional because like there's just been so many deaths in my family and just my friend
not
circle.
you, young lady. Not you.
I know, but it just I'm so big on like my mental health that like
You're healthy.
I don't know.
Clean bill of health. So just easy with the medications. And we're here when you need us. Go have some fun.
Well, thank you.
You're welcome.
I'm gonna end this, guys. All is well. Amen. I'll leave this up. But this is really important, and I really thank you for like squeezing me
You're
in
welcome.
because I was really nervous. I didn't go to sleep this morning till like 6.
Yeah, it's scary. It's always good to get checked out because we have patients who don't make it past surgery. You know who some of them are, Joan Rivers. So always safety first. You don't know what you're looking for, and then sometimes you find stuff by accident that can change your life, save your life. I've seen it many times in my practice. I'm not even expecting it. We find stuff, and we're able to keep people safe, especially for elective surgeries that wasn't necessary. So. A good surgeon will always make you take the extra step and get the pre-op. That's a good doctor. It's a pain in the ass. It's an extra step, extra day, but you don't get it back if you die. So always get checked out.
Thank
You're
you.
welcome.
Bye, guys.